Direction du Kenya pour parler de ce petit détour.
CRTV News, ici, toute l'info.
Let's now move on with Cameroonian doctors in the United Kingdom. Under the association CamDocUK, they have been assisting their communities, giving to hospitals, assisting doctors that is back in Cameroon, and even training their peers. They have equally handed quite a good number of anti-COVID equipment back in Cameroon. CamDocUK's chairperson is Dr. Linda Bello, and she is joining me live from London. Now, Dr. Linda Bello, first of all, tell us what CamDoc hopes to achieve by coming back home, by celebrating with their peers back home, and by assisting them in times of difficulty.
Hello, and thank you for your kind invitation to the program today. So you were asking, what does our group hope to achieve? What is our raison d'être? And as you mentioned earlier, my name is Dr. Linda Bello. I am the CamDocUK president. So our group, CamDocUK, was born, so to speak, on the 1st of March 2008. We had an inaugural meeting in Leicester. So we are an embodiment of like-minded medical doctors and allied medical professionals of Cameroonian origin. We aim to help improve on the existing healthcare systems in Cameroon by engaging government, non-governmental organizations and charities that align themselves with these aims. We would like to undertake formal and informal needs assessment of primary and secondary healthcare facilities in Cameroon, and to negotiate for, acquire and facilitate the provision of medical equipment from various sources to support healthcare institutions in Cameroon where they can be put to good use.
If I got you very well, Dr. Linda Bello, you want to give back to the country at a time when we understand the atmosphere out here, when some people have been hostile towards their community. But before I get to that, I want to know from you, what have you been able to do as your association CamDocUK?
So how do we think, can we say that our PPE is helping to show our patriotism or contributing to building the nation? And do we think that there's more ways that we could contribute to shaping the future of this country? Wow. So we at CamDocUK, we're quite passionate about this. We believe that our PPE project goes to support our colleagues in the front line. We need to protect frontline workers in the event of any major disaster, including pandemics, if we want to minimize the impact on the population. Our PPE project has therefore supported the Cameroon people directly and indirectly. Our project was not only limited to PPE, we have carried out awareness and education campaigns on various aspects of COVID-19 that we believe are contributing in shaping the future of our community. Healthcare is a pillar in any community, and CamDocUK is well grounded to contribute in improving the situation in Cameroon. For example, the project of the universal health coverage in Cameroon will significantly impact the way healthcare is delivered in Cameroon, and CamDocUK has members who can contribute towards the meaningful delivery. We are already playing a major role in the education of the healthcare professionals of the future, and we like to continue that collaboration with various institutions. This activity alone has far-ranging impact on the future of healthcare, contributing towards the capacity building and for professionalism. So through our webinars as well, we are shaping public knowledge of health-related issues. So yes, we are ready when we are going to be called, and we would like to be more involved.
I'm sure, Doctor, that many Cameroonians are excited there, knowing that you'll be able to help them whenever the CamDocUK, and we've also understood that your group is delivering personal protective equipment to hundreds of hospitals in Cameroon to beat the COVID-19. From what you just said there, and you're ready to join in the Health for All coverage. Doctor, can you tell us more about your activities?
Yeah, you understand that we're delivering our PPE, yes, the PPE project. Yes, we would like it to be hundreds of hospitals, but we're currently trying to supply to 100 hospitals. So how did this come about? Very good question. So you may remember, and I'm sure you do, that in June this year, you kindly, when you interviewed our previous chairperson, Dr. Morgan, you kindly aired our solidarity video. So that's how it all started. You know, during the pandemic, we thought our colleagues, you know, they must be going through a really difficult time. You know, we were also going through that. So we thought, what better thing to do than to create a solidarity video which tells our colleagues that we are there with them. Then in April this year, we launched a fundraising appeal to raise funds, and we wanted to be able to deliver PPE to our colleagues in Cameroon. We knew that even in the UK here, we were getting shortages of PPE. What more than Cameroon? We thought that it could even be similar or worse. So I am pleased to say that it was quite a successful appeal, and we were able to procure a significant amount of PPE. So as I was highlighting earlier, we are aiming to reach 100 hospitals, 10 in each region of the country, and distribution is currently ongoing. So we're really, really proud that we've been able to do this.
One might be tempted to call it a show of patriotism and solidarity to contribute in the building of your nation back here, Cameroon. What other ways can you help your own very country, because there are so many needs?
So yes, yeah, creating a group with countrymen, yes, can demonstrate our desire to belong to this country. Yeah, I mean, being a member of a group with like-minded people, with people from the same country as you, shows that we share common interests and ideas. We aim to support our people, so our fellow Cameroonians, both in Cameroon and outside Cameroon. We all believe that Cameroon can improve by utilizing the available resources while developing new capabilities. Being in the diaspora gives me a different perspective on things. But, you know, home is home, and of course I miss it. The networks are different, but we do, and I do, try to keep in touch in different ways.
Before you leave us, Dr. Linda Bello, you may be having so many things to do for your country, to propose back in your country, and to assemble people out there. Maybe you have something you wanted to tell them that I did not ask you?
Yes, I'm sure it's quite evident to see that we're proud, and we want to really keep up with things going on back at home. We want to keep up our conversations that we're having with you. And again, thank you for having us here for the second time. So why did we create this association, and what plans do we have for the country? Wow. So CamDocUK was born out of a desire of Cameroonian medical professionals to get together, share their experiences, support each other, and work towards improving healthcare in our communities, both in the UK and in Cameroon. So solidarity, being together, it's vital, not just for ourselves, but also to enhance our capacity to develop our country. And so by tapping into our overall potential, we can be able to contribute in a meaningful way to our country. We have shown this potential already through this amazing PPE project, and I believe that to date we've probably made one of the largest donations of PPE by a diaspora group. So you know, we're really, really quite proud of this.
That was Dr. Linda Bello, the CamDocUK chairperson, who was with us live on the line to London. Doctor, thank you very much for being there.
So, what have we been able to achieve in the past? Yeah. So as I was saying before, we were born in 2008, the group. 2012 to 2013, we carried out some official teaching at the University of Buea. In 2014, we officially registered within the CMC, the Cameroon Medical Council, and the Cameroon High Commission. And in that year, we donated some books to the University of Buea. We established a mentorship for children. We donated 50 beds to hospitals in Cameroon. That same year, we also visited Cameroon with a delegation from the World Orthopedic Concern. In 2016, we established small grant scheme and carried out volunteer operations on 400 patients. We set up a medical library in the University of Buea following a needs assessment, and we took part in the examination of the first batch at their final exams. To conclude, well, it's been a real pleasure to be here today. Thank you so much for inviting me. Thank you for letting us, tell you about our organization. And I hope to have the opportunity to update you in the near future about any future projects that we will be doing. Thanks again.
Thank you very much, Dr. Linda Bello, who answered a call all the way from London in the UK. And she's a Cameroonian doctor based in the UK, chairperson of the CamDocUK, a group that was created a long time ago to help Cameroonians back at home. Doctor, never mind, whenever you come home, we shall be able to receive you. And thanks very much to keep us updated on your activities, and we shall inform Cameroonians. This is Twilight. This is CRTV News.
Merci de nous faire confiance comme ceci tous les dimanches. Lorsqu'il est 18h, on a 1h30 à passer ensemble à décrypter toute l'actualité sportive de la semaine.
Aujourd'hui, on a simplement revu l'organigramme et que là, le ministère des Sports ou encore le gouvernement de la République a pris les choses en main.
Vous allez voir que le CHAN est assez symptomatique de la réalité des clubs africains. Quand vous voyez le RD